Hey loves, welcome back to my channel. Oh my god, it's been such a long time of me posting in real time content, you know, and I'm back. I am back, you guys. Happy New Year. Happy New Year to you all. I haven't seen y'all all year, and I hope your year has been going well. Man, I don't know where to begin because I've been MIA. I've truly been MIA. My apologies. So many good things have been going on in my life that I just couldn't keep up with creating, editing, and posting. I couldn't keep up with that, with everything that's been going on, all the positive things that's been going on in my life. I wish I was keeping you guys updated. This video, I'm going to be talking about nursing content, and later on, I will give you guys a life update. That's not what I plan to do today. I just plan to jump right into giving you guys some nursing advice, and we'll catch up later with what's been going on in my life, okay? So welcome back, you guys. If you're new to my channel, please hit that subscribe button, y'all. I am going to be consistent this year. That is one of my goals, is to be consistent, posting regularly, you know, and not holding off content and waiting until it's like months later to post it. Like, I'm trying to cut that habit out and just be disciplined and post my content regularly. So please subscribe to my channel and turn on that bell notification so that you're notified every single time I post. I'm also going to be incorporating a lot of shorts on my channel, so please show me love on my shorts as well when I post my shorts here on YouTube. But yeah, you guys, I am back and I'm ready to give you guys content, so please stay tuned. Don't forget to hit the like button to let me know that you guys are enjoying my content, to also motivate me to keep posting content for you guys. And yeah, let's jump right into this video. All right, you guys, so in this video, I'm going to be talking about 5 essential tips that are going to help you answer NCLEX-style questions. Have you been struggling to answer those NCLEX-style questions, those tricky NCLEX-style questions? Well, just know that you're not alone. And with the right strategies, it will help to boost your confidence and ace your exams, whether it's your exams in nursing school or it's your actual NCLEX board exam. These 5 essential strategies are going to help you to pass your NCLEX-style exams. So if you're interested in knowing the 5 essential tips that you need to know to pass your exams, please stay tuned and keep watching till the end. All right, you guys, so let me give you guys a little bit of a background about myself. I am a registered nurse. I graduated with my bachelor's in nursing degree in 2019, and since then I've been working as a registered med-surg nurse. I've been in the med-surg world for a couple of years, and I think it's going on 6 years, and it's been an experience, you guys. It's been a really good learning experience. If you're a med-surg nurse, you know you get anywhere from 4 to 5 patients, even sometimes 6 patients to 1 nurse ratio. And it's not always easy to have that many patients, but just me being used to the environment and been doing this for a while, I mean, I can't complain about it, but it's not for everybody. Med-surg nursing is definitely not for everybody. I'm even actually looking for a specialty to get into after working as a med-surg nurse for this many years, but we'll talk about that later on down the line. I've also done travel nursing, and I did that for like 2 or 3 years, getting to experience different states and working in their hospital environments and following their protocols. And that was also a really good experience. Travel nursing, if you ever have the opportunity to do travel nursing, I think you should definitely go for it. It does open your eyes and just show you other things outside of the norm that you're used to in, you know, working in your hometown or your regular hospital that you work at. So I am currently a staff float pool nurse. in a hospital. I work night shifts, so 12-hour shift, night shift, 7P to 7A. My schedule is very much so flexible right now, which I am so grateful for, because being burnt out is a real thing, and that's what I used to be at times. But right now I'm very satisfied with doing float pool and still under the med-surg world. So that's a little bit of a background about me. So if you're a med-surg nurse, hey, how you doing? So let's get into these tips, you guys. Starting with tip number 1. Tip number 1 will be to, when you're answering your NCLEX-style questions, incorporate ADPIE. ADPIE is important when answering NCLEX-style questions. Now let's break down ADPIE. The A stands for assessment, the D stands for diagnosis, P stands for planning, the I stands for implementation, and the E stands for evaluation. ADPIE. And so you want to use ADPIE when it comes to your priority questions. When it comes to priority NCLEX style questions, assessment usually comes first. Let me pull up an example for you guys. So let me pull up an example for you guys. Okay, here's a good one. It says, a patient is short of breath. What should the nurse do first? A, administer oxygen, or B, assess respiratory rate and lung sounds. Now, we talked about how in priority questions, assessment comes first. So what do you guys think the answer would be? If I'm looking at it, I would say that assess respiratory rate and lung sounds would be the right answer, because you want to assess the patient to even know how much oxygen to administer. So that's tip number 1. Tip number 1 is, when you are answering NCLEX style questions, use ADPIE to answer mainly priority questions. When you see the NCLEX style questions say, what are you going to do first? What is your first action? You know, what is the priority in this scenario? Try to use ADPIE and go from assessment and work your way down. But just know that assessment usually comes first. So tip number 2 is going to be using Maslow's hierarchy of needs. When we talk about Maslow's hierarchy of needs, it's typically the 5-tier pyramid, which I'm going to implement here. So Maslow's hierarchy of needs, usually it helps nurses to determine what should be addressed first in patient care. So it's broken down into 5 tiers in the pyramid, and the first one is physiological. So with your physiological needs, which is your most important, you talk about your basic survival needs, like your airway, breathing, circulation, food, water, sleep, and elimination. These things must be met before anything else. So when you're answering your NCLEX style question, think physiological needs are met first. Those are the most important to address when it comes to patient care. Then you go down to your safety and security, which includes physical safety, fall prevention, infection control, things of that nature. Love and belonging, you focus on like family, friendships, relationships, therapeutic communication, and just like emotional support, you know, and then self-esteem, and then you keep going down to self-actualization. Self-actualization is the least important. It talks about personal growth, reaching full potential, and fulfillment. So you just start from the very top and work your way down. But when answering NCLEX style questions, keep in mind that your physiological needs are most important. Your airway, your breathing, circulation, water, food, those come first. So let's analyze the question so you guys can better understand how to incorporate Maslow's hierarchy. All right, so I pulled up a question, and the question is, the NCLEX style question is, a nurse is caring for 4 patients. Which patient should be prioritized first? A patient who is feeling anxious about an upcoming procedure. B, a patient who is requesting assistance to call their family. C, a patient with low blood pressure and dizziness. Or D, a patient upset about not receiving their meal on time. What do you guys think the correct answer would be according to Maslow's hierarchy? If you said C, you are correct, because blood pressure and dizziness, it is a physiological need that could indicate circulatory issues, which is more urgent than the other answers listed. I cannot stress this enough that physiological needs and safety needs come first. They take priority over love and belonging, self-esteem, self-actualization when it comes to the Maslow's hierarchy of needs, and you're using that to answer your NCLEX-style questions. Tip number 3 is to watch for keywords. Watch for keywords and avoid distractions. So keywords like best, priority, most appropriate, those words are what you want to highlight. And you want to avoid the absolute words like all, always, never, only. When you see those words, that's a red flag because that's usually the wrong answer. When you see the word only in an answer, don't choose that. If you see the word always in an answer, don't choose that. It's most likely wrong. So watch out for those distractions because they will try to get you in those NCLEX-style questions. Focus on the keywords like best, priority, most important, first action, those are just some that come off the top of my head. Let me see if I can find an example question for you guys. All right, you guys, so I found a question for you guys, an NCLEX-style question. As an example for tip number 3, it says a nurse is caring for a post-op patient who reports severe pain at the surgical site. What is the best action? A, always reposition a patient before giving pain medication. B, immediately administer the prescribed opioid medication. C, assess the patient's pain level, vital signs, and surgical site. D, encourage deep breathing and distraction techniques instead of medication. What is the correct answer? If you stated C, then that is correct. You always want to assess the patient's pain level, vital signs, even the surgical site. This also goes back to ADPIE. You can definitely use ADPIE in this question because it asks you what is the best action. And usually you want to assess your patient first. So yeah, you guys, just be very cautious when it comes to the absolute words. Always, never, all, none, must, immediately. They often indicate incorrect answers. When I see never in an answer, I usually never pick that answer. I never pick never, because 9 times out of 10, it's incorrect. So that's tip number 3 for you guys. We're moving right along. We're on tip number 4. You all hang in there. I hope you guys are staying with me because these are very important tips to help you answer those NCLEX-style questions like a pro. So tip number 4 will be prioritizing safety and ABCs. ABCs meaning airway, breathing, circulation. We've already talked about airway, breathing, circulation when it came to our physiological needs. It's very important when answering an NCLEX-style question, especially the prioritization NCLEX-style question. Those priority NCLEX-style questions, you want to prioritize your ABCs. For example, if there's a patient who is bleeding out versus a patient who can't breathe, which patient will you prioritize first? You will prioritize the patient who cannot breathe first. Airway is going to kill the patient faster. If you do not stabilize that patient's airway, that's going to kill the patient faster. So that's why it is a priority to choose your patient who's not breathing over your patient who's bleeding out. Airway, breathing, circulation is very important when it comes to NCLEX-style questions. Tip number 5 is to stay in NCLEX world. I know it sounds kind of weird, but it is important to stay in NCLEX world. Hence, that's why there are NCLEX-style questions. You want to stay in NCLEX world. You don't want to overthink the questions. You don't want to assume in the questions. You don't want assumptions. You don't want to read too much into the question. You want to pick out the keywords and break down those tips I gave you guys to see which tip will help you answer the questions correctly. It is so easy to get lost in the question, get lost in the weeds. You want to stay focused on the keywords in the question and then use those strategies I mentioned earlier to help you answer the questions. Please do not second guess yourself. Usually the gut answer is the right answer. Whatever your gut is telling you, choose that answer. I used to second guess myself a lot when it came to NCLEX-style questions. Second guessing really set me back. All right, you guys, so that's the 5 essential tips when it comes to answering NCLEX-style questions like a pro. So let's do a quick recap on the 5 tips. Tip number 1 is understanding the nursing process using ADPIE. Tip number 2 is using Maslow's hierarchy. Tip number 3 is watching out for keywords and distractions when it comes to answering NCLEX-style questions. Tip number 4 is prioritizing safety and ABCs. And tip number 5 is just staying in the NCLEX world. The NCLEX-style questions are very tricky. And if you don't have enough practice with NCLEX-style questions, it could really, cause you to struggle when answering those questions. You can really struggle when answering those questions. So do enough practice questions with NCLEX-style questions. Use these strategies that I've provided you guys with, and you should be able to ace your exams when the time comes. I hope that these strategies, these essential 5 tips helped you guys out, and you guys will utilize them when answering your NCLEX-style questions. Thank you all so much for watching my video. Don't forget to hit the subscribe button. Like this video if it was helpful so I can know to make more content like this. And I'll see you all in my next video. Bye, guys.